Hi, my name is Shoshana Wilkinson, and today I'm going to perform an assessment of the peripheral vascular and cardiovascular systems. How I begin any assessment is I walk into the patient's room and greet them. My name is Shoshana. I'm going to be your nurse today. After I greet them, I do take time to wash or sanitize my hands, and then I come back over to the patient and I would look at his wristband and ask him for his name and date of birth.
John Curtis, March 1st, 1985.
Okay, and I understand that you are here for an assessment of your peripheral vascular and cardiovascular systems. Did anything bring you in? Are you concerned with anything going on with those? Do you have any swelling, tingling, discomfort in your chest?
No.
No, nothing. Okay, and at this point, I'm looking at my patient's general appearance. I'm looking at his mood, his affect. I'm looking at whether he's disheveled or he's wearing appropriate clothes, if his hair's done, things like that, to assess the general appearance of my patient. From there, I would go ahead and begin vitals. Put the pulse ox on. I'm sorry, I did not mean to scratch you. Okay, and his oxygen is 99%, his pulse is 54. During this, I would have counted respirations for the sake of time, since this is not the respiratory system. I'm going to go ahead and just do a blood pressure. I would also ask for his pain level and do a temperature as well for the vitals. So I'm going to go ahead and do his blood pressure. There we go. Blood pressure was normal, 118/74, so that's good. After I do that, I would begin asking my patient different diagnoses that he might have. I would ask him about family history, past medical history, if he's had any surgeries, does he smoke or drink, and how often. I would ask about relevant systems and review those with him. So that's what I would do for that portion of the assessment. Then I would begin to look at his skin color, start assessing the upper extremities, and look at them. His skin color is good, it's warm, there's no moisture, no issues. His skin integrity is really good. I would then go on to assess his nail beds, make sure that they turn white, and then come back within 2 to 3 seconds. Just do a couple of them. So, and I would also do that with will you lift your foot up and take your shoe off real quick? I would also do that with his toes, like make sure that they blanch and turn white, and come back within a few, turn a pink color, within a few seconds. So after that, I'm going to go ahead and make sure, like I said, like that there's no skin lesions, No open areas. His skin integrity is good. I'm going to go ahead and assess his skin turgor on the back of his hand, and it bounces right back, so he's not dehydrated or anything. I'm then going to listen to his brachial artery. And that rate is good, the rhythm's good. Strong and steady. At this point of the interview, I will go ahead and feel his radial pulse. At this point, I could take a radial pulse. You can count for a full minute, and then whatever number you get at that minute, at the 60-second mark, would be your radial pulse. Or what I do is count for 30 and multiply by 2. His radial pulse on both sides, since it's not the carotid, are good and strong. Yeah. So then what I would perform is the Allen test. And that's where I would squeeze both sides, the ulnar side and the radial side pulses, get his hand to turn a pale color and get cool. After a few minutes of holding it, that will happen. You let go of the ulnar pinky side, and within 5 to 15 seconds for a negative Allen test, your blood should be back to that hand. It shouldn't be tingling, it shouldn't be cool, and it shouldn't be pale within 5 to 15 seconds, like I said. So all of his pulses, all of his peripheral pulses were good. I'm gonna have you stand up for just a second, I'm sorry. Then, moving down the body, I would go ahead and feel his femoral artery pulse. And it feels good and strong. Same thing with that one. I'm gonna have you lift your knee as well. And then I would feel both popliteal knees, but since he's in a chair and not laying down, I'm going to do one. The popliteal pulse is right here, and it's good and strong. I'm going to have you lift your leg as well. Will you scoot back some so they can see, thank you. So the posterior tibial pulse, like the artery, you can feel it right back here. And this is the one, if you can't find that dorsalis pedis, this is the one that you will always be able to find. So his is good and strong. And this is the dorsalis pedis, of course, that I'm palpating and feeling for. And it's good and strong. Like I said, I would have done both popliteals, both posterior tibial pulses, and the dorsalis pedis pulse, but since I don't have the bed and he's sitting, I'm not going to make him raise both of his legs. So moving on, the next thing is the ankle brachial index. And I don't have a Doppler, but I'm going to go ahead and explain this test. I would put the blood pressure cuff back on his arm, and I would find that brachial pulse with the Doppler. And once I found the pulse and heard that it was good and nothing was making a sound to where I couldn't hear, I would puff or pump the blood pressure cuff back up, and then I would release it. I would pump it up to where I don't hear any more heartbeats or pulses, and then I would release it, and then whatever number that pulse that I hear that pulse on is the number that I would write for the arm blood pressure. and that, well, I'll explain here in a second, but the arm blood pressure is what I would put for that. I would also put a blood pressure cuff about right here on his foot, and I could either listen to his dorsalis pedis or his posterior tibial pulse, and do the same thing that I did with the arm. Find it with the Doppler, make sure that it was clear and good, pump that blood pressure cuff up until I don't hear any more sounds, and then release it, and then that number I would put for the ankle blood pressure. And you divide the ankle blood pressure by the arm blood pressure, and that should give you the ankle brachial index. Normal ankle brachial index is 1 to 1.4. That's where you would want that for a healthy person. So anyhow, as I continue to assess my patient, I'm going to go ahead and move on to the chest. I'll look at his contour, again, looking at his skin integrity. It's not, it's not cold. There's no discoloration, nothing weird there. The contour's good. I don't see him retracting that much, but I do see like a nice, even, steady rising and falling of the chest, which is what you want to see. I'm going to look for, at this point, I would ask him to go ahead and lay back, and I would look for different pulsations. Like there's a natural pulsation right here in your epigastric region that happens, that if someone's laying down, that you naturally see pretty steady. And so then the other one, I would come up and look at the jugular. You don't have to lift your head if you don't want. Look at the jugular pulsation. And it's pretty steady and strong. Yeah, so it's pretty steady and strong. I'm then going to go ahead and fill his carotid artery one at a time, because you can make someone pass out by filling them both. That side's good. I'm going to just come over to this side, give it a break for a second, fill the side. They're both steady and strong. While I'm here, I'm going to go ahead and listen for a brute. Listen to the other side, I'm sorry. No brutes in either. While I have my stethoscope on, I want to go ahead and locate his apical pulse, which is about right there. I can feel it first and palpate it first, and it's nice and strong, and then that's where you would do the apical pulse. To get the apical pulse, you should count for the 60 seconds for the full minute to get the apical pulse, of course. While I'm here, I can listen to his S1 and S2. Sounds. Make sure there's no extra sounds, no gallops or anything. No murmurs. And that they're audible in all locations, and they are. So that is good. Once again, I feel like that's a basic assessment of the peripheral vascular and cardiovascular systems, and thank you for watching.